Hello friends of TV Agro. Greetings, Edwin Hernandez, anesthesiologist veterinarian and in charge of the tomography part of the veterinary specialties clinic of the country. Today we will talk about veterinary tomography. The idea of this is that we learn when to submit a study, what to use a study for, in which cases it should be requested, how to handle the patient, at what times we should take it and how we should transport the patient to the clinic. Well, here we have a tomograph. The tomograph is human, but it is clearly adapted for veterinarians. Our clinic is adapting everything in a way that is as medically as possible. Here the idea is that with a team of these we can generate a diagnosis as much as possible and as strict as possible in patients. The idea as such also of this type of machines is that we give it the greatest use. We also know how to use it in these cases, and we must also take into account that tomographs versus resonators have a limitation, and as well as we can use it very well in cases such as bone tissue. We are talking about bones and neoplasms, we are talking about tumors, also because it is very limited in other studies such as the nervous system. Our studies are mainly directed in a method that X-rays are used to generate specific images. And as such you can define what are the alterations and pathologies that are generating the patient. We can make head studies, spine, abdomen, thorax and bones. We have a team that can generate a very high image quality. Well, in this machine we can introduce patients of all kinds, from a puppy of less than a kilo, to animals of 200 kilos. The idea with this type of studies is to generate an accurate diagnosis in case of placing an example, if the patient has an intra-abdominal tumor. Because the idea is to do the study as such and see if that tumor is to remove it or not, and if it is removable and enter as fixed and safe so that the anesthetic procedure lasts as little as possible. It must be taken into account that in order to perform a study of this the patient must be under general anesthesia, not a procedure that is done with the sedated patient or with the patient on the table, must be under general anesthesia. Why? Because the images must be obtained and the patient must be completely still. Many times simply the breathing of the patient can alter the image, and if we are talking about very small alterations, or say a tumor of 1 centimeter, the movement of the thorax of the rib cage and breathing can alter this image and can give us a false negative or a false positive. Then it is important that patients should always be under general anesthesia is also very important as taking into account the anesthetic risk of the patient. Usually the most common is that patients who enter the area of tomography are patients in critical care or in critical condition. For that reason we have an area in charge of anesthesiology, which as I directed, the idea is that the patient generates a very short anesthesia. This device takes approximately 30 to 40 seconds to acquire the images. But with anesthesia requires a protocol. Usually the entire protocol is taking between 15 and 20 minutes, that's the time we've planned for the patient to be under anesthesia. Well, to keep in mind as I spoke to you now, there are also limitations in the neurological area on this equipment. But it also gives us the opportunity to quickly diagnose as well as it is done in humans. Their appliances are used to quickly diagnose strokes when they were generally acute. It is a very diagnostic tool. As I was saying, is a device that takes very little time to obtain the images, and so the patient will be under anesthesia for very short time. Other studies in which we can give very accurate information would be in chest studies, are being suspected of alterations at the bronchial level, at the pulmonary level, at the cardiac level. There we can determine from simple masses to lessons of occupying space, to bronchi, bronchitis, pneumonia, and so on. We can also be very accurate with that diagnosis. And the other would be directly in the abdominal cavity. In abdominal cavity, we can generate many diagnoses, which are very limited with other types of diagnostic tools. Very clear example could be a pancreatitis or neoplastic alterations at the level of what is vessels, of what is liver. We can also detect foreign bodies when we are not sure of the diagnosis if one should enter surgery the patient, and mainly neoplasms. Neoplasms are very important in the abdominal cavity, and we can determine the very specific and exactly with this type of studies. Well, as indicated by the patient under general anesthesia, the prior requirements for anesthesia are very basic. They are exactly the same as we need for surgery, pre-anesthetic examinations, the most general, depending also on the age of the patient. The idea is that patients under 7 years of age enter with the basic general examinations for an anesthesia, and over 7 years of age enter with slightly more specific examinations. Mainly with this type of studies, it must be taken into account that the contrast medium is a contrast medium which uses iodine, and iodine can become nephrotoxic. It is important that this renal function is optimal for the patient, and logically because we must be sure of that so as not to generate any alteration after the examination of the patient. The study is very fast. The patient must leave the clinic as well as admission. If these patients enter walking, they must leave walking. The recovery of each patient is individual, each patient is different. There are patients who take 5 minutes to get up from the table and are perfect, like others that take up to half an hour or an hour. The idea is that as we have everything corresponding, our medical team and facilities, the patient recovers and exits as he enters here. And also that the owner in some way or other be assured that his patient will not be under any anesthetic influence after he leaves the clinic. Taking into account that this is a procedure under general anesthesia, the idea is always to have a patient as stable as possible. This gives us a slight limitation in case we would like to refer a patient, because the clear idea is that the patient should have the corresponding study and leave as it was admitted. There are patients in whom I do not recommend as such generate this procedure. Mainly patients who are lung unstable. We have had cases in which patients come with a very severe pneumothorax, so they become complicated at the time of anesthesia. We have not had any failure in such procedures, and patients have left. But fortunately, as we have a trained medical team that can solve the problem at the same time, you as veterinary doctors, if you are going to submit a study of these, as we try to send a patient as stable as possible, to make this procedure as successful as possible. I know many of you may be wondering what's the difference between an X-ray, a CT scan and an MRI. Are 3 very different imaging studies, but that can provide us with different types of information, that depends already on what we are trying to diagnose. An example, as the name suggests, X-rays, uses X-rays to cross tissues and give us an image. What happens is that the X-rays can only give us maximum 3 views. 3 views, what does it mean? One which is lateral is as if the puppy is side by side and we take a picture of the side. Another either anteroposterior or inside rosebush, it is as if the puppy or kitten is lying in front and you will take a picture of front, and another can be oblique, which is simply can be a like profile, are the 3 views that you can love. A courageous way to define in an X-ray. With a tag we can define many more planes. We can make planes well be of the side, from top to bottom, from front to back, from back to front, and we will only need a single route. Then we will give much better image. We will define very well the organs, and we can have some more specific reconstructions in different types of angles. Mainly it is what we can give the tomograph. In addition, we must take into account that the tomograph, thanks to the use of different amounts, between quotation marks of X-rays, can generate more specific images in both bone tissue and soft tissue, thing that X-rays are very limited. And already in the last part we are talking about resonance. The resonance does not use X-rays, uses magnets to balance the hydrogen atoms. As you know, mainly our body and all organisms are composed almost all of 70 to 80% of water, and hydrogen atoms are there. That what a resonator does, or what makes a magnet of those, align them, and to be aligning them in some way or other obtain images. It's a totally different studio. Hello TV Agro, how are you? I present, my name is Franklin Vargas, I am a technologist in radiology diagnostic imaging and work as an operator of the TAG team of the Clinic of Veterinary Specialties of the country. So in this case I want to expose the team, is a team Toshiba, reference Super Forestian, for cuts, is a very good performance equipment, low dose radiation, and is a very efficient equipment. The approximate study time is 30 seconds to 2 minutes. Very well. This facility consists of a fully feathered room, which passes all the standards required by the Colombian standard in terms of ionizing radiation. If we also have an injector, with which we will apply the contrast dye to patients who require it, request it, or need it. Also for the equipment, because the X-rays 90% becomes heat, then we have to have an air conditioner which should commonly refrigerate us at 19 degrees. If you look you can get to 16, but it's really done to make up for the size of the room. Alright, then here is our computer management console, which we have different equipment. We have a monitor on which we are observing how the patient is, both the monitor and the patient's state when we are doing the study of the tag. If we have the equipment, the console in which we are going to handle the computer as such, in which we are going to see the technical factors of how far the study will go and how long it will last. We also have the monitor of the injector, of medium contrast, in which we are going to give the volume and the flow with which we are going to inject the medium contrast. This depends on the weight of the patient and also depends on which vein we have, which catheter we are using, to know how much contrast we use and how much flow we will use to inject you. Here we have our image reconstruction console, in which we acquire the image in that console and we pass it here to make its respective reconstruction, which we are going to make 3D images. We can make dorsal constructions and also of agital constructions. Well, friends of TV Agro, I hope you liked this note. Serve this information and try to generate a greater diagnosis in our patients to give quality of life. Remember, my name is Edwin Hernandez, veterinarian, physician in the area of anesthesiology. These facilities are in the Veterinary Specialties Clinic the country. See you later.